أشهد أن محمدا رسول الله. حي على الصلاة، حي على الفلاح، قد قامت الصلاة، قد قامت الصلاة. الله أكبر، الله أكبر، لا إله إلا الله.
بعد الله استووا استقيموا واعتدلوا، حاذوا بين المناكب والأقدام، شدوا الخلل، استووا. الله أكبر. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. السلام عليكم ورحمة الله. السلام عليكم ورحمة الله. اللهم أنت السلام ومنك السلام، تباركت يا ذا الجلال والإكرام. لا إله إلا الله وحده لا شريك له، له الملك وله الحمد، يحيي ويميت وهو على كل شيء قدير. اللهم أعنا على ذكرك وشكرك وحسن عبادتك. اللهم إنا نعوذ بك من عذاب القبر ومن عذاب النار ومن فتنة المحيا والممات ومن شر فتنة المسيح الدجال.
This is the talk on cancer screening now. Inshallah, please make sure you can sit down for a few minutes, inshallah.
me know when you're ready. Okay. Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Okay, so my name is Dr. Suhail Tarafdar. I'm a doctor, GP. I'm based at Small Heath Medical Practice in Birmingham, so that's in the West Midlands. And this is a campaign where we're trying to raise awareness of cancer screening in the UK, because we know that in our community, the Muslim community, but actually not just Muslim community, but Asian community, Black African community, that cancer screening is not really uptaken. A lot of people, they don't do the screening. So this is actually, as part of the British Islamic Medical Association, we're doing a campaign across the UK to try and raise awareness about cancer screening. And this is something that's very, very important. And we're being supported by Cancer Research UK, the Muslim Council of Britain as well. So first of all, can I express my thanks and gratitude to the committee members, particularly to Brother Adil for allowing me to speak here today. And thank you for all the people that have attended and for those who are watching live as well. Just before I continue, this is just a disclaimer that the purpose of this talk is to provide general advice. It's not aimed at anybody specific. So, and if you do have any kind of questions, you're more than welcome to ask me. I'm happy to take questions. Or you can also email, which is just provided there as well. If anybody has any questions during the talk, just ask. And please make this as interactive as possible as well. So what I want to discuss today is briefly, very simply, what is cancer? Can it be prevented? So can we prevent cancer? Why is cancer screening important? And what are the national screening programs? So of the different cancers that exist in the UK, which particular screening programs are there to try and pick up these cancers early? Okay, first of all, can I just take a question from the audience? How common do you think cancer is? So can somebody shout out an answer? So give me a percentage. Give me a percentage. 40, 50, anyone else? Sorry? 10, 60%. So on average in the UK, it's about 50%. 50%. Statistically speaking, in someone's lifetime, so if there were 100 people in a room, statistically speaking, 50 of them can get cancer during their lifetime. So 50%. So can you see how important this topic is?
What's causing that?
Well, I'm going to come to that shortly. I'm going to go through that shortly. So that just kind of just illustrates how important this topic is. Another question I just want to ask, you don't have to answer this if you don't want to. Personally, has anybody experienced cancer, or do they know somebody, a loved one, might be a mother, father, brother, sister? Has anybody got any personal experience of cancer? Can you put your hand up if you know anybody? So again, you can see that this is just how important this topic is. And inshallah ta'ala, even if only one person benefits from this talk and decides to go for the screening, and it's beneficial, then may Allah accept. This is what this is about, okay? And I want you to please just go away and speak to your family members, benefit yourselves as well by please going for the screening. This is what this talk is about today. So first of all, what is cancer? So this is just a very simple summary. So cancer is basically, it's a medical condition, and what it is when the cells in the body, so everybody has cells which make up the body, the cells start to grow and it's uncontrollable. The two major kind of bits which are important with cancer is what we call the invasion. Invasion is when the cancer starts to attack the other bits of the body, other cells in the body, and destroys the other organs surrounding the cancer. The other important bit with cancer is what we call metastasis. So you've probably heard, I'm sure, that if somebody has, for example, breast cancer, it's gone to the liver, or it's, a cancer's gone to the brain, we call this process metastasis. And it's these two particular processes which are kind of feature within cancer. So that's kind of what cancer is very generally. So you probably know the answer to this from my talk, but if I was to say what is the main cause of death in England and Wales, what do you think the answer is? Cancer. Any other takers? So somebody saying heart attack and cancer as well. So 28% of all deaths in England and Wales is because of cancer. Okay? So it's maybe a third. That's how important this problem is. I think a lot of people think it's heart attack as well. It is important, it's 26%, but you can see that cancer is slightly higher. Okay? Next question for the audience, please. Which cancers do people think are the most common? Can you shout out some answers, please? Prostate, anyone else? Lung, sorry, anyone else? Breast cancer, yeah. So, actually, you're not doing too badly, well done. So, obviously, there were lots and lots of different types of cancer. The 4 common types of cancer are breast, lung, prostate, and bowel cancer. So, those are the 4 kind of most common cancers in the UK. And as I said, 1 in 2 people, so that's 50% of people, statistically will develop cancer during their lifetime. So every year in the UK, 360,000 people are diagnosed with cancer. So the next question is, well, can we do anything to try and prevent cancer? Can we make changes in our life to try and reduce the risk of cancer? Yes, we can. So actually, about 40% of all cancers in the UK could be prevented by making lifestyle changes. So in other words, 40% of cancers are thought to be caused by things which we can change, things which we can modify. And I'm going to go through them as well. So does anybody have any idea what these might be? Just some of them are common knowledge. So somebody saying diet. Anybody? Anyone else? Any other takers? Yeah? Smoking, brilliant. Any others? Yeah? Drug use? Okay. So let me these are I'm going to go through the common ones here. So smoking is the single most important one by far. And the size, if you look at the slides, the size of the circle represents how important smoking is in terms of the cause of the cancer. So lung cancer, which I think most people know, is the most important association with lung cancer is smoking. But you can also see a whole range of other cancers, such as bladder cancer, cancer of the gullet, the esophagus, cancer of the throat. So there's quite a few there, you can see. And then somebody also mentioned diet, which is linked as well, because I think this is something that's maybe overlooked. A lot of people don't understand this, but actually being overweight and being obese is, after smoking, the biggest cause of cancer. Okay, so you can see that includes bowel cancer, it includes breast cancer, gullet cancer, esophageal cancer, kidney cancer. So being overweight and smoking are very important causes of cancer. And also, you mentioned diet as well. So this, again, it's common sense. We know which foods kind of are good for us, most of us, and we know which foods are bad for us. We know that things like processed food, sugary food, high-calorie foods are no good for us. And actually, that not only are they no good for us, but they are linked with cancer as well. And a healthy, balanced diet, which is fruits, vegetables, non-processed food, are all things which can reduce your risk of developing cancer. Okay? And that just explains the pathology, how is it that food can, and being overweight can lead to cancer. And it's just thought to be because of the excess fat cells. Right, so this then comes to kind of screening and why screening is important. So if I was to say the word screening, what does everybody understand by the word screening? Yeah? Okay, so somebody's saying that their understanding is it's like a diagnostic test. Anyone else? So just testing generally, yeah? Okay. Excuse me. So first of all, this kind of just saying what screening is more to do with the purpose. So screening is basically detecting cancer from the early signs. So screening is about picking people up even when they don't have symptoms of cancer, so that they can be treated when they're at an early stage or even before they develop the full cancer, because sometimes people have a precancerous stage. So you have the cancer, the full-blown cancer, and then you have before that, you get some changes, and we can treat those changes before it even develops cancer. So that's kind of what screening is. So think of it as a filter. So screening targets a specific group of people. If you think of like a filter, most people will be fine and have no problems, but the people who we pick up changes with using the screening, we can then look into them further. So to answer the question, screening is not actually a diagnostic test as such. What it is, it's a mechanism, it's a process by which we can try and identify people who might have changes which may indicate cancer in the future, or who have early cancer, for example. Does that make sense? Yeah, is that clear? So in other words, why I'm saying this is because some people may think, well, I am fine, I don't have any symptoms, why do I need to go? Most people that have cancer, a lot of people will have no symptoms at all until they get late stage. And what the purpose of the screening is to pick things up early. Okay? Yeah. I'm going to go through the 3 national screening programs in the UK. Okay. So screening, it does reduce the risk of people dying from cancer. So it detects cancer early. So 63% of cancers which are detected through screening are at an early stage. So these are the ones that we can hopefully treat. And it also even prevents cancer, because as I said, certain cancers will have a stage before it becomes the full-blown cancer, and before it gets the invasion and the metastasis that I mentioned earlier, and we can treat it before then. So, does anybody know which are the 3 cancer screening programs in the UK? Does anybody know? Do you want to shout out? Yeah. Breast cancer. Any others? Bowel cancer. Yeah. The third one. Prostate isn't a national program. No. Anyone else? No. It's cervical. Okay. Cervical cancer. I'll explain what that is. Yeah. So these are the 3 programs which are currently in the UK, and these are the screening programs that are available nationally in England, Scotland and Wales and Northern Ireland. So the first one is bowel screening. So bowel screening is basically trying to pick up signs of things which indicate possible bowel cancer or before it becomes the full-blown cancer. So it consists of a one-off test, which is an endoscopy, a camera test through the back passage, a sigmoidoscope, at the age of 55 years. That's done as a one-off. And then between the age of 60 to 74 years, people receive a kit in their home, and every 2 years they're asked to return the kit to a particular place, and that's then tested. So that's the bowel cancer screening program. So the 2 things is the camera test, and the second thing is every 2 years between the age of 60 to 74 is completing that kit that you receive through the post. The second cancer screening program is the breast screening program. This is for women aged between 50 to 70, and they're invited for what we call a mammogram, which is an X-ray of the breast, and that's every 3 years. In women who are above the age of 70, they can actually request to have it done even beyond that, but that has to be done separately. Same with the bowel cancer screening. If you're above the age of 74, you can actually order a kit to get tested as well. For cervical cancer, that's for women aged 25 to 64 years. It's every 3 years when they're aged between 25 to 49, and between the age of 50 to 64, it's every 5 years. Okay? I wouldn't worry too much about the bottom bullet point. I think the important take-home message is these are the 3 major cancer screening programs in the UK. So do you have a question? Yes. So after the age of 70, so the question is, just for those who are live, for example, after the age of 74, do we get a reminder that we have to request a kit? Usually, after the age of 74, you do have to contact yourself if you require, and I've left lots of leaflets outside which you can use to contact. The number is on there, and I've also left a leaflet which explains how to do the test using the poo sample, which I'm going to go through anyway. So let's just go through briefly the 3 cancer screening programs. Can I just say also, I can't see the sisters at the moment, because obviously I'm with the brothers here. So can you please take this message back to your loved ones, all your family members, including the sisters, because it's a really important topic, and it's really important that people do the screening. Okay, so does anybody know what percentage of bowel cancers are linked to major lifestyle factors? Originally, I was going to do this by asking people to stand up, sit down, and put their hands up, but I think I think some people have limited mobility, so I won't do that. Okay, so if anybody thinks it's A, can you put your hand up? What percentage of bowel cancer is linked to things which can be changed with our lifestyle? If you think it's A, put your hand up. So we've got one. If you think it's B, put your hand up. And if you think it's C, put your hand up. Okay. So the answer is actually A. So half of bowel cancers are linked to actual lifestyle factors, like smoking, diet, obesity, being overweight. It's a big number. And it just tells you why, as doctors, people can get bored of the doctor saying, you need to lose weight, you need to do this, you need to do this. We're not saying it for fun. We're saying it for your benefit. Okay? So bowel cancer is the 4th most common cancer in the UK. About 16,000 deaths a year. Can I just also say that 57% of people with bowel cancer do survive 10 or more years? Why am I saying this? Because people can think, I don't want to go for the screening because if I get picked up as having bowel cancer, I have no hope. You do have hope, inshallah ta'ala, because 57% of people with bowel cancer do live for 10 or more years, or even beyond that. And the whole purpose of the screening is to pick up things even when you don't have symptoms. Yes? Yeah.
Has that got anything to do with actually how we use our toilets at the moment?
How we use our
toilets we use at the moment actually.
our toilets.
That's right, yeah. Because the reason I said, once actually watching a program on BBC, I believe, right, yeah, and there's actually the toilet we use at the moment, it's not the proper way of sitting down. And what that causes actually, because we put a lot of pressure in there, sometimes we tear ourselves to the bowel side. And that's something actually, the rubbish comes out. And that normally actually stays in there, and that can also lead to typhoid.
So the question, yeah, sorry.
They're saying actually the toilet we use in this country, right, which is not ideal for us, but the ones we actually using like in the Middle East, the way we sit down, which is more better for us.
Okay, so the question that's been asked by the brother is, is there a link between the bowel cancer and the way we sit when we're using the toilet? So I'm sure we're all familiar with the Western toilets, which is kind of the high commode, and then the low commode is when people kind of squat. And is there a link? What I would say is, if I'm honest with you, looking at the evidence, it's hard for me to comment, because for something like this, you would need to look at maybe something like a case control study. And as a professional, as a doctor, it would be hard for me to say without any kind of research evidence. I know, and there are some anecdotes of people saying that sitting in a certain way is beneficial. There are lots of people that have come to me and said that. And the population that I work with in Small Heath Medical Practice is particularly South Asian, Afro-Caribbean. A lot of them are Muslim, so they're used to using low commode toilets, and they do report that it helps their if they have problems with their bowels, it does help them. But in terms of research evidence, I can't really say 100% unless there's specific papers looking into this. Does that make sense?
Yes. But I believe actually that our body is designed a certain way.
Yeah.
And as a doctor, right, we have advice. I mean, for example, just like if you have a bent pipe, and of course, right, for the to get out, there's going to cause a bit of a clot, or block, The straight pipe right here, that goes straight out. Now, where we sit, like in high commode and low commode, which is actually more, what's the right word for it, which would be actually more better for us to actually release our bowel.
Okay, so the question is, which one is better for low commode or high commode? So, as a doctor, I would say, generally, there's definitely no harm with squatting. First of all, so if somebody chose to squat and it helped them, there's absolutely no problem with doing that. I can't see any issue with doing that. So, I can't say 100% in the absence of research evidence which one is squatting or sitting on the normal toilet is more beneficial. what I can say that it's as a Muslim, the sunnah of the Prophet ﷺ is to, obviously we know, is to sit when we're using the toilet. And one of the reasons why a lot of Muslims, that's one of the reasons why a lot of the Muslims, they use the low commode toilets, unless of course there's a disability. And as Muslims we believe there's a hikmah, there's a wisdom, there's a benefit in that. But actually in the absence of research, it's hard for me to say 100% which one is better, because in terms of sunnah, obviously it's better as Muslims, but in terms of research evidence, I can't say 100% either way.
According to the research they have done, essentially the way we sat actually in high commode, it's like, for example, the bowel itself is quite tight. It's not actually open properly. But if you sit down properly, the way actually is a sunnah, then your bowels, the pipe is totally open. Because it's not open properly, right? There's something like a string is holding it tight. You are actually really pushing to release that. If you don't have a soft valve, if you have hard valve, right, at the time you can tear it. I'm not talking about this Muslim thing. I'm talking about
like I said, it may be the case, but
here the doctors, because this has been going for some time now. They're not actually find that.
I would have to look at the quality of the studies. Have they done a case control study? Have they done? It's hard for me to comment without looking at the specific study and the quality of the study. But obviously, as a Muslim, I like to follow the Sunnah as much as possible. So for me, I don't need anything else personally. Yeah. Yeah. So the brother here is just saying, for the benefit of those alive, that if you are sitting on a high commode, you can use a stool to raise your feet as well. It's just for the benefit of others. If it's okay, we just move on? Yeah? Okay. So these are just ways about how we can reduce bowel cancer risk. So obviously smoking, not smoking, being more active, avoiding processed food, eating a diet which is high in fiber, so that's things like fruit and vegetables, having a healthy weight, and not drinking alcohol or cutting down on alcohol. Okay, so the next question is, what are the symptoms of bowel cancer? Okay, I'm going to have opportunity to ask a few more questions to the audience. I'm just going to carry on so we don't run over. These are symptoms which can occur with bowel cancer. If you do develop these symptoms, then please go and see your GP. The purpose of screening is not to necessarily diagnose a cancer. The purpose of screening is to pick things up even when you have no symptoms. So if you do have symptoms, it's very important that you go and see your GP so that you can get further examination, testing. They'll speak to you, take a history and examination, and then refer you, if necessary, for further tests, such as blood tests. So things to look out for is bleeding in the toilet when you're having a poo. It's a change in your toilet. So, for example, if you're getting looser toilets and it's persistent, sometimes people even feel a lump in their back passage or in their tummy. If people are having to strain and they're not usually straining, and this is something that's continuing for a period, and if people they can't explain it, they just lost weight, they're getting tired, they're getting breathless, please get seen by your GP. Okay, so I think I kind of answered this. So how often is the bowel cancer screening in the UK? 2 years, yeah. So we're already well informed. So as I said, at the age of 55, everybody gets a bowel scope. And then from the fecal occult blood test, I think there's next slide. Okay, I'm going to go through that in the next slide. So this just shows that it's a sigmoidoscope. It's a camera test at the age of 55. You'll be invited to have this test done where the part of the lower bowel, so the sigmoidoscope, that's a sigmoid colon there, so it's kind of round there. You get a camera test just to have a look for things like a polyp. A polyp is something which is like a growth, which may or may not be a cancer. Often it's not a cancer, but then they can be removed during the procedure and then tested. So, and the estimation is that out of 220 people that undergo this test, one less person will die from bowel cancer over a 17-year period. And if you think how many people there are in the UK, that's a lot of people. So people are invited. They're asked to have an enema, which is just something that they take to clear up the bowel, because obviously you don't want poo in there. You want it to be clear so that you get a clear view when you're doing the test. They have a discussion beforehand, And then normally about 20 minutes it takes, and then any polyps that they pick up, anything abnormal they pick up, sometimes they can take a sample from there and then that can be sent off for biopsy. Sorry? So once it's removed, well, it depends what's removed as well. So, for example, if they send it off and it shows features of cancer, then you'll be invited again, and you'll have a further test, maybe a resection, whatever, like a surgery. If it's a non-cancerous, then often you don't need any further treatment, but they may want to recheck you every 3 years. Does that answer your question? Yeah? Okay. So, at the moment, the test that's used every 2 years is the fecal occult blood test, which is where you have to do 3 poo samples, but that's been replaced from April 2019 by the fecal immunochemical test. It's just so that you're aware, this is just a one-off test, so you don't have to do 3 poo samples, it can just be done in 1 sample. So from April 2019, this is going to replace the old way of doing it. So some of you are nodding and are probably familiar with the old way. So bowel cancer, so men and women aged 60 to 74 are invited every 2 years. And after the age of 74, you ask for the number, it's actually on here as well. But there are leaflets outside anyway. The screening is completed at home, and then you send it off in the envelope that's provided. And what the sample is doing, it's looking for tiny amounts of blood in the toilet, which you can't always see with the naked eye. And if there is blood, you're then invited for further testing, because a tiny amount of blood that you can't see with the naked eye can be a sign of bowel cancer. Obviously, you won't notice that because it's microscopic, you can't see it with the naked eye. But obviously, if you see frank blood, you must see your GP, as I mentioned earlier. Clear? Is that, yeah? So the reason why the FIT test is taking over the current test in April is because the FIT test is probably going to pick up another 1,500 cancers more, because it's much more sensitive. So that's why it's just, if you're asking the question, well, why is that? That's the reason why. And as time is going on, you'll see that hopefully new screening programs are coming from different cancers, and the existing ones are improving over time. So the FIT test is basically, so it's just that there. So it's you take a poo sample into there. I'm going to show you how to do it. I'm going to discuss it a bit later. And that's from the age of 60 to 74 every 2 years. Okay, so sometimes people ask, so this is just practical tips on how can I get the poo. This might seem a bit disgusting, but it's important. There are loads of different ways that you can collect the sample. Some people even use cling film. Some people put it into an old tub that's clean, then they put it into the sample. There's different ways. I can see whether Adil can send this link around, but basically there is even a link which shows possible ways of collecting the sample. Yeah?
But before you go through that process, will the doctor direct that way?
No, because it's so the question is, before you go through this process, will the doctor direct you? The answer to that is no, because this is sent to the home address of every person registered with a GP aged between 60 and 74 every 2 years, but the instructions are in there. But the reason I'm showing this is just because some people may think, oh, well, I'm not going to be able to do the sample, I'm not going to do the test. But there are lots of practical ways of doing it, getting the sample. And that just shows, so this is the brother was asking, what's the FIT test? So you just label it, you remove the actual top, you collect the poo sample, as it shows there, and then you just put it into there, you give it a shake, and then you just send it off. It's a very simple test, very effective, and it can pick up things before, early cancers before it gets too late. So there's not really any reason not to do it, really. So what happens to the test? Well, 3 outcomes. One is there's nothing detected, it's normal, no problem, every 2 years. The second one is the result is unclear, in which case the test might need to be repeated, so you'll be sent another test to do. The third one, it's abnormal, in which case you will be invited for an appointment to discuss that. Out of 100 people that do the current test, the fecal occult blood test, 2 people do have an abnormal result, so 2% of people have an abnormal result. And the ones that have an abnormal result, they have a full camera test. So before, the one at 55 is just up to here, but the full camera test is the whole of the large bowel. They can see the entire bowel, large bowel. Of these people, out of 100 people that have this test, 50 people will have nothing detected, 40 people will have polyps, so that's what I discussed earlier. Most of the polyps aren't cancer, and they can be removed and tested, but 10% will pick up cancers. So obviously with every test that you do, there's benefits and harms potentially, and it's important I tell you about both. But what I will say is the benefits far, far, far outweigh the harms, and it's definitely worth going for. But my duty is to tell you about benefits and harms as a doctor. So the benefits is obviously it does save lots of lives. It reduces the risk of dying by 25% from bowel cancer. People that have the test have people that have the actual, so that's the screening, 25%. But people that have the bowel scope test have a 40% lower risk of dying from bowel cancer. So you can see it does really save lives. And I've already mentioned this, so it does reduce the risk of developing bowel cancer by 1/3 during the bowel scope. So what are the harms? Well, no test is perfect, first of all, which does mean that sometimes the test will be positive in people that have no problem. But that's why we look further to see if it is a real problem or if it's a false problem. Sometimes the screening can miss the cancers. Most people, it will be picked up, but obviously no test is perfect, and occasionally things do get missed, even after the test. So you've probably heard of people that have had an X-ray and something's been missed, or they've had something and it's being missed. And sometimes, this is what I just want to stress, even if you have a normal test, if you still have symptoms like bleeding from the back passage, weight loss, please go and see your GP. The test is not a diagnosis, it's to pick up things early. That's the purpose of the test. So sometimes 1 year down the line, after having the test, you think, well, I know I'm bleeding from the back passage, but my screening was normal, so it's fine. But please, it's important you do go and see your GP still. Obviously, the follow-up tests, like the actual scope, the camera test has to have its risks, such as bleeding, for example. I would say that the benefits definitely outweigh the risks by far. So next, it's the cervical cancer screening. So the bowel cancer was the biggest part of the talk. These ones are slightly smaller. So this is the 14th most common cancer in the UK. Almost 1,000 deaths a year. Just to say why it's important, 63% of women that do develop cervical cancer live for 10 years or more. So it's not a case of, oh, I'm going to lose hope. I'm not going to go for the test because if I get picked up with cervical cancer, then, what will I do? There is hope, so it's worth doing. Most cervical cancer is caused by a virus called HPV, but about 21% is caused by smoking as well. Most cancers, as I said, are caused by the human papillomavirus, which is a virus that infects around 80% of people in their lifetime. Okay, so it's very, very, very common. The two main types, there's different types of HPV virus. The two main types, the 16 and 18, which cause most of the cancers. And the reason why I'm saying this is because since 2008, girls aged between the age of 11 and 13 will be offered the vaccine. So you might have daughters or sisters, and I would recommend that you get the vaccination done because it cuts your risk of having the cancer in the future, the girl's risk. But even if you have the vaccine, as you can see, it will protect against maybe these types of cancers, but the other 30% can be caused by other types of the virus. So even if they have symptoms, they should still get help, go to the doctors. So, does anybody know what the symptoms of cervical cancer might be? Any idea at all? So cervical cancer, it's the neck of the womb that's affected. So it can be bleeding between periods, bleeding after intercourse, bleeding even after they've had the menopause, getting vaginal discharge and pain. And if these are persistent symptoms, when I say persistent, I mean particularly things like pain. I mean, people might get pain on and off now and then, but if it's persistent or if it's different, just get help. Go and see your doctor. If you get bleeding after menopause, so a lot of people here might have wives, a lot of the sisters that are watching might have been through the menopause. If they're getting these symptoms like discharge and bleeding, please go and see your doctor. It's very important. So, does anybody know, I did say this earlier, so just to see if everybody's awake, At what age do women receive their first invite for the screening for cervical cancer, or for actually cervical screening? What age? So we have 25. Yep, so the answer is C. Well done, nobody's fallen asleep yet. Okay, so the aim of this, so you've probably heard of the smear test. So this is what the smear test is. It's a cervical or cervical cancer screening. It doesn't find cancer. It picks up things which are in the cells which might develop into cancer in the future. So that's the benefit of this. Although it does sometimes pick up cancers, actually the purpose of it is to pick up cells when they're abnormal, and thus in such a way that they can develop into cancer in the future. That's why it's beneficial to have this. So you have to be registered with a GP, aged 25 to 64. Women are invited every 3 years until the age of 49. And after the age of 49, between the age of 50 to 64, women are invited every 5 years. And that's just so you have the speculum and then they just take a sample. It's not normally painful, can be a bit uncomfortable, but it's definitely worth doing. The results are then checked by a specialist under a microscope, and following that, women might be invited for a camera test to have a look down below to see if it does look like cancer. And they actually do test for the virus, the HPV virus, which, as I said, is in 99% of cancers with cervical cancer. So if it's positive, then they will be invited for the camera test. If it's negative, they can normally just go back to normal screening every 3 years or every 5 years. And that's if it's kind of mild changes. If it's moderate to severe changes, then women will just go directly for the camera test. And if the test is unclear, the results are unclear, then women will be asked to repeat the test. So out of 100 women that have this test, 94 will have a normal result, no problem. 6 will have abnormal result. And out of those 6, 2 will have no infection with the virus that I mentioned, so they go back to normal screening. But 4 of them out of the 6 will be invited for the camera test. And that's just showing an animation of what the camera test looks like, which is the speculum is inserted, and it's just like a magnifying lens, and they look to see, does it look like cancer or not? This is just to say that the NHS is looking to use HPV testing as the main test for cervical screening, rather than doing the other thing that I mentioned. So that's just in the pipeline. So I'm just mentioning it because it's something that you may come across in the next 12 months or so. And that's because it does seem to save more lives than the current test. So again, no test is perfect. What are the benefits and the harms? So it saves 2,000 lives. 2,000 women are saved every year by this test. That's how important this is. And the benefit actually increases with age. As the woman gets older, the benefit of the screening actually increases as well. And it's actually reduced the incident rate. The incidence is basically the new cases of cancer. So the new cases of cervical cancer have gone down ever since the screening was introduced. So it's had a major, major impact. Obviously, I've already mentioned that sometimes the test can be positive when it's actually normal. It can sometimes be negative when it actually they do have an abnormality. No test is perfect. Sometimes when we pick something up, we do treatment, and obviously that can lead to over-treatment. I've already mentioned the false reassurance. So if women do it, if you've got a sister that does have a symptom, if you've got a wife that does have the symptoms, for example, or if a sister's watching, they do have symptoms that I've mentioned of cervical cancer, please don't be falsely reassured. You should still go and see your GP. And obviously, women can obviously have a psychological impact, like they can be affected mentally if they have the infection and they worry, well, will I develop cancer in the future? And the treatment obviously carries risks as well, such as pain. But what I would say is that the benefits definitely outweigh the risks in my view. And then finally, breast cancer screening. Again, hopefully this is just short and sweet. So this is the most common cancer in the UK. 150 new diagnoses every single day. Does anybody here have any experience of breast cancer from a family member? Anyone here? Yeah. So this is the most common cancer in the UK. It's really important that people go for screening for breast cancer. So I think that's in the slide. It's going to be in the slide. So some brothers asking what causes it. So there are around 11,400 breast cancer deaths in the UK every year. So 11,000 every year deaths. And actually, 78% of women do survive for 10 or more years with breast cancer. So I don't want people to think, I'm not going to go for the screening, there's no hope. What if they pick something up? Actually, there is hope, inshallah ta'ala. And 23% of breast cancers are preventable. And that's things like your lifestyle, being overweight, being obese, to answer your question. Obviously, some of it is genetic as well, for example, but which you can't change. But certain things you can change to reduce your risk of cancer generally, like cutting down smoking or not smoking, cutting down alcohol in people that do alcohol, cutting down your weight, avoiding processed food, those kind of things. We do know that women who breastfeed have a lower risk of having breast cancer, so breastfeeding is beneficial. So what are the signs and symptoms? Please pay attention to this and take it back to the brothers here, take it back to your sisters, your wives, everybody. The sisters watching, please, again, look out for these symptoms and signs. So things to look out for is a change in the size, the shape, the feel of the breast. Sometimes people feel a lump, which this is just a common misconception. The breast cancer can also occur in the armpit. Do people know that? The breast tissue actually goes all the way to the armpit. So if you pick up a lump in the armpit, it's just as important to see your doctor urgently, okay? Because that can be a sign of breast cancer. Also, sometimes women that aren't breastfeeding or who aren't pregnant, they can get discharge from the nipple. Sometimes the nipple or the skin changes, and sometimes women get persistent pain in the breast. So see your GP for things like this. Brother has a question. Sorry? So the question is, do men get breast cancer? And he said, I know it sounds silly. Well, it's not silly at all. The answer is yes. Men do get breast cancer. That's another common misconception. But breast cancer is much, much, much more common in males than females. If a man does get breast cancer, it's important to look for genetic causes. So there are certain genes like the BRCA gene, the P53 genes. There's certain genes that we will look for in men that have breast cancer. So yes, men can get breast cancer. And if they do, their family members need to be checked as well. It must be, I can't give you the exact figure on the top of my head, but it's probably less than 1%.
So what's the physical check for a man? You get lump on the arm?
Say that again, sorry.
What's the physical check?
For men or... Same, so often it's a lump. Often it can be discharged from the breast. It's similar to what's here. So it can be a change in the breast. It can be persistent pain. It can be discharge from the nipple. It can be changes which don't fit with eczema. It's just like so. If you're concerned, it's just obviously you need to see the doctor. Just go to the expert, get it checked out. Okay, yeah. Okay. Does anybody know? So if women are picked up with screening, for example, at stage 1 of their breast cancer, how many of them survive 5 or more years? A, B, or C? If you think it's A, put your hand up. If you think it's B, put your hand up. If you think it's C, put your hand up. Okay. So the percentage of women who are diagnosed with stage 1 breast cancer that survive 5 years or more is 99%. Do you see how important it is? It's the most common cancer in the UK. If you pick it up at stage 1, 99% chance that people survive 5 or more years, often even beyond that. But most of the research looks at 5 years for survival. That's why you'll see 5 years for lots of things. So breast cancer screening is done as an X-ray, what we call a mammogram. For women aged between 50 and 70 years old, they have to be registered with the GP. They're invited through the letterbox as a national screening programme. And basically 2 X-rays are taken of each breast, and the X-ray is looking for any signs which might indicate breast cancer. And often nowadays these are done not just in the hospital, but actually in have you seen those big lorries where they do the X-ray? So often it's done in those. So please, I urge the brothers here and I urge the sisters watching. It's the most common cancer in the UK. It's really important that you go for the breast cancer screening. Once women are aged over 70, they can refer themselves if they still want to have the tests, the regular screening. So what happens to the women's mammograms? So they're sent They're examined and the results are then sent to the GP and to the lady who's had the test within 2 weeks usually. If there's anything that's a problem, then they will be invited for an assessment in the clinic. And often, sometimes if it's unclear, then they will be asked to have the test repeated. So this just shows, out of 100 women that have the screening, 96%, so 96 women, no problem, normal result. 4 of them, however, will be called back to have more tests. Out of the 4 that are called back for the tests, 3 will not have cancer, but 1 will be picked up. And if you think how many people are having this test, you see it's actually quite a lot. So, as I said, again, no test is perfect. So you'll see often it's quite a repeat. So what is the benefit of breast cancer screening? Well, or benefits, because there are lots of them. It does cut down the number of deaths from breast cancer by about 1,300 a year. That's a lot. Often breast cancer will be picked up at an early stage, and so inshallah ta'ala it can be cured and picked up, treated and even cured. And as I said, 99% of women who can be picked up at stage 1 survive cancer for 5 years or more, and often beyond that even. So as I said, again, sometimes you can get a false negative result, which is when the cancer isn't there, but it's picked up as... So false positive is where the cancer is there, but it's cancer isn't there, but it's shown as positive, and the opposite of that is false negative, because no test is perfect. But we do know the test generally is reliable anyway. Sometimes, as I said, if you do have symptoms of breast cancer, your sister has symptoms, you have symptoms, just go and get help from your doctor. Don't be falsely reassured. Obviously, when you're doing the test, there is some radiation exposure, so that does have some harm, potentially, but the harms are small, and the overall benefit is much more because breast cancer is so common. And sometimes cancers are picked up which are actually not that harmful, but the problem is we don't necessarily know which ones are harmful and which ones aren't as harmful, so often they're just treated. So that can lead to overdiagnosis and treatment. However, on balance, the benefits, I would argue, definitely outweigh the risks by far. So just to summarize, thank you for your patience. So as we said, there's a bowel cancer screening, there's a breast cancer screening, and there's a cervical cancer screening. And I've just gone through all 3 of those. The key message is that screening can help to detect cancer earlier, and in some cases even prevent cancer. It's important that the information that I've given to you, inshallah ta'ala, is reliable. So don't be put off by, sometimes people go and Google and they do searches, but the information I've given today is reliable. I've hopefully been balanced, and actually the benefits far outweigh the risks, I would argue. Screening, can I just stress, is not for people... screening is for people that don't have symptoms and to pick it up earlier. If you do have symptoms, don't wait 2 years or a year or 6 months for a screening. You just go to a GP because you may need further tests there and then. And so screening is basically about being like a filter to identify people that are at risk of having the cancer. And this is just a hadith. Ibn Abbas radhiyallahu anhu reported that the Messenger of Allah sallallahu alaihi wasallam said, "Take advantage of 5 before 5, your youth before your old age, your health before your illness, your riches before your poverty, your free time before your work, and your life before your death." Okay, Allahu A'lam. Thank you very much for your patience and for listening. I'm more than happy to take questions. So the brother is asking, is there no screen for liver cancer? So just before I go, can somebody arrange for the sisters' questions? Yeah, so can you just... how are the sisters going to give their questions? What's the mechanism? Would you mind just coming here? Because... have you got an alternative? Or? So if the sisters have any questions, is this on WhatsApp? If the sisters have any questions, can you get ready, get your mobiles out? Okay, I'll just give you a few seconds. Because what it is, you're going to ask your questions to this mobile number, and then it will come through to me. So the number is, 07966 118 958. So can I just repeat that? 07966 118 958. Okay. So sorry, the brother here was asking, is there any screening test for liver cancer? So at the moment, there isn't a screening test for liver cancer. And the reason for that is because when you do a screening test, you have to make sure it's reliable. So by reliability, I mean it has to be something where you don't get too many false. Remember I said false positive, false negative. You want to avoid that as much as possible. So the test itself has to be reliable. The tests that are currently in the UK for these 3 screening programs that I've mentioned, they are validated. There's been lots of research looking into them. We know it saves lives. So we have to make sure the test is reliable before we can use it. There's research always ongoing about different types of cancer. So who knows, in the future there may be. If you're concerned about liver cancer for any particular reason, for example, if you have weight loss, if you're getting persistent pain, obviously that's why you would have to see your doctor about that. Any other questions? Lung cancer. So the brother here was asking, is there a screening for lung cancer? Once again, because at the moment there is the test itself hasn't been validated, it's not reliable enough at the moment. There isn't currently a test for lung cancer. I believe they are looking, at the moment in the UK, they are looking to see if it's possible, because lung cancer is very common. Some examples of symptoms and signs to look out for lung cancer might be a persistent cough for more than 3 weeks, for example, people coughing up blood, people having weight loss, particularly in people that have been smokers or there's a family history. I would definitely advise you that you need to get checked. Often you would be examined, they may send you for an x-ray, blood test possibly, those kind of things. So the brother here is asking about prostate cancer. Before I answer that question, so you want to know there's a screening for prostate cancer. What do you understand about this? Has anybody heard about anything to do with prostate cancer and screening? Anybody heard about anything? So has anybody heard of the PSA test, first of all? Yeah, so a few nods. So the PSA test, so at the moment there isn't a screening for prostate cancer, but I do know that they're doing research to see if that's possible, because the test itself has to be reliable. What I would say is the PSA test is a test that's done in the GP surgery. It's not entirely reliable. So my personal practice as a doctor is if somebody comes to me and they're saying that they keep on passing urine, they have difficulty controlling their urine, sometimes they might see blood in the urine, those kind of things. I would normally advise that they get the PSA test done if it's appropriate. Every case is different. Your doctor will often have reasons why they want you to go for this test or not. But personally, it depending on the circumstances, if I think it's appropriate, I will send the person for blood tests. I will then ask them to come back to see me and I will examine their back passage, because you can feel the prostate from the back passage. And I've picked up quite a few cancers over the last few years. But most people that have these symptoms, a lot of people, men, this is very common. We call it benign prostatic hyperplasia. It's a condition where the prostate gets bigger. It's not cancer, it's just getting bigger, and that can cause problems. But you can get help for that anyway. Even though it's not a cancer, you can still get help and treatment for that. So the brother's asking that he had a stroke 18 years ago, and sometimes when you need to go for a wee, sometimes there's not much notice, is that right? And could that be, potentially that could be due to, I don't know the full details, I would need to know the full history and everything. Potentially that can be due to a stroke. What I would say is I would see your GP about that still, because you might possibly, depending on the history and everything, you might need to have further investigation. But I don't know what's already been done or not, so it's hard for me to say without your notes. Yeah? Yeah? Should we take this one first and then, sorry, yeah? So, very good question. So, I've got a question which is, can kids get cancer? Definitely yes. So, what I would say is that most cancers in the world happen in older people, not necessarily older, but in the 40s often, sometimes younger than that. So generally speaking, not a disease of childhood, but there are certain cancers which are certainly more common in children. As for example, certain nephroblastoma, like a kidney cancer, neuroblastoma, which certain brain cancers are common in children. Well, not common, but occur much more in children than they do in adults. So obviously, if there's any parental concern about a child, again, just get seen, because children can get cancer as well. Sorry, the brother here had a question. Yeah, do you want to? Yes, sure.
If a person gets picked up for bowel cancer, what's the treatment and how long will it last? Question one. Number two, what about stomach screening?
Okay. So there are two questions from the brother. The first question is, if somebody's picked up to have bowel cancer, what is the treatment and how long? The second question is, what about stomach cancer? So to answer the first question, if somebody's picked up to have bowel cancer, what is the treatment? It does depend on the stage of the cancer, first of all. So usually it's categorized into 4 stages, bowel cancer is. The earlier the stage, the more curable it generally is. So the aim is to cure the cancer, if that makes sense. So if we divide, just as a general rule, the treatment for cancer into a few broad categories, not just bowel cancer, but other cancers as well, like lung cancer. One treatment is to have surgery, where you remove the actual cancer bit. The second broad category is chemotherapy, which is where people have drugs which kill the cancer cells. And the third category is radiotherapy, which is where radiation is used to also kill the cancer cells. The treatment duration does depend on the type of bowel cancer. There are different types of bowel cancer, for example, adenocarcinoma, and there also depends on the stage of the cancer, so it's hard for me to say specifically. But like I said, a lot of the cancers that are picked up, people do have a long-term survival. And particularly with stage 1 cancers as well. The second question was, what about stomach cancers? Once again, it's about finding a test that's reliable, but research is always ongoing to see what else we can use as a reliable, validated test to screen for stomach cancer. Things to look out for with stomach cancer can be problems like weight loss, food getting stuck when you're eating, problems with swallowing, persistent vomiting, people feeling tired, lacking energy, which is persistent. These are things which can possibly indicate stomach cancer, but at the moment there's no specific screening test for it at the moment. Oh, okay. My mobile's with my battery's died.
The question is about sarcoma.
Yes. Okay. So one of the sisters is asking, sarcoma cancer, can it of the bone, can it be detected at earlier stage? I mean, that's a difficult question because, I mean, potentially, of course it can, yes, but it was also about the location of the sarcoma. So, for example, sarcoma, basically, just to explain, it's often like a cancer of the bone, osteosarcoma. So it's a cancer of the bone. So in certain places it can be more noticeable. In certain places it can be more prominent. Does that make sense? So it's much more likely to be picked up. However, in areas which are a bit more conspicuous, areas which you won't necessarily see or can be more difficult, sarcoma often can occur in children and adults. It often will cause pain in the bone. Some people will notice a growth. Sometimes it will be picked up on an X-ray. Sometimes it will be picked up on an X-ray where the X-ray is done for something else and it's picked up incidentally. So, but there's no current screening program in the UK for it. You said there was another question. Okay, fine. So, are there any other questions before we wrap up?
We have different screens like MRI and CT scan.
Mm-hmm.
Can you detect any of this?
Say that again, sorry.
We have MRI scan and CT scan. Right?
Yeah.
Can that be used to detect any of this?
So the brother's asking the question, we have MRI scan, we have CT scans. Can this be used to detect cancers? So the issue here is that with certain tests that we do, there's always a benefit and a risk even with the test. So, for example, if we're doing a CT scan, we are exposing people to large amounts of radiation, so the benefit has to outweigh the risk. So if we were to, and MRI, not everybody, for example, can have an MRI. It's also expensive, so the program itself has to be effective, cost-effective, because it's a national program. And also you have to know which populations you're targeting when you're doing the test. And it has to be a validated test, it has to be a reliable test for the condition you're testing for. So it's, although in principle we can use things like CT and MRI for certain things, I don't think it can be used just like that indiscriminately. There has to be a specific purpose, there has to be a rationale behind it before you go ahead and go for a test. Brother, here has a question? Yes. Signs of brain cancer. Okay. So the brother's asking, are there any signs of brain cancer? So yes, there are. What I would advise is brain cancer can often present kind of like insidiously. It's not. Sometimes it's hard to pick up. And the reason why is because people can present with very general symptoms. So sometimes it's obvious. So for example, they might lose part of their vision, they might get limb weak, the limb might suddenly get weak and weaker. Sometimes they might lose weight, sometimes it's people changing in their personality. Sometimes it's a change in someone's behavior. So it's not always very clear. But obviously, I think a lot of people would find that alarming and would get help from the doctor if they did develop those kind of symptoms. It's okay? Any other questions?
Before you just leave about next, just in case if there's something for children or for women, what's the first point of call? What do you need to do? Just a couple of minutes and then we'll be back.
Okay. So, can I just go to this slide first of all? I think this is probably one of the most important slides in my presentation today. So I've talked about what screening is. It's about helping to detect cancer earlier and in certain cases even prevent the cancer from occurring in the first place if you're picking things up before it becomes a full-blown cancer. I'm hopefully being balanced in talking about the overwhelming benefits but also some potential harms of screening. But I would urge brothers and sisters and I would to go themselves for the screening, but also I would urge brothers and sisters to speak to their loved ones and encourage them to go for the screening as well. I would also say that if somebody has any symptoms and signs that they're worried about, then it is important that you go and see your GP still. Don't be falsely reassured by the screening, because, for example, if somebody's had a normal breast cancer screening a year ago and now they're starting to get changes in the breast skin or they're getting discharge, it's still really important you see your GP. And again, the purpose of screening is, as I said, is to pick up cancers before they become a cancer or pick it up at an earlier stage. What I would say is that kind of also as a closing statement is, brothers and sisters, please don't lose hope. Put your trust in Allah Ta'ala. And even if something, we believe that everything is a test from Allah, don't we? We believe that we should take advantage of the 5 before the 5. This is an opportunity for us, brothers and sisters. And I think something is this amazing thing in the UK, which we don't have in other parts of the world. Most of us today have said that they know somebody that's been affected by cancer. So, and the harms are very, very small. The benefits are overwhelming. They're huge. There's no reason that I can see, really, for people not to go for the screening. And so I think the closing statement here is that cancer is common. Statistically speaking, 1 in 2 people, 50% of people, develop cancer during their lifetime. We have this opportunity and to really increase the uptake of screening in our community. amongst Muslims and non-Muslims, who are amongst Asians, Africans, white people, all races. But we know that it's not up to, the screening uptake is poor in for example, the South Asian community. So it's essential that we use this opportunity and from the talk today, inshallah ta'ala, to promote cancer screening.
I know it's finished, but there's someone just texting right now.
Yep, we have a question.
The question is, my uncle's got brain cancer, often, but he's bedridden, doesn't even open his eyes. Does that mean his senses are gone, he's not improving, or deteriorating? So the question is about someone's had an off for brain cancer, now the person is bedridden, the condition as it goes just post-op, till now it's exactly the same. So that means he's lost all his senses,
So we have a question from a sister who's saying that the relative has had an operation for brain cancer, and after the operation they're still the same in terms of they're not waking up or they're not responding, that kind of thing. Are the chances gone or not? I would say that not necessarily. It's hard for me. I don't have enough information really. It depends on the stage of the cancer. It depends on how long ago the operation was. It depends, are they in intensive care or not? There's too many things unknowns that I can't comment on really. But I would say that not necessarily. I would strongly urge them to speak to the consultant in charge of their care to get a realistic. It's hard for me without the information to. So if they speak to the person in charge of the care in the hospital to get as much information as they can. There's too many things that I don't know to answer the question. Can I just say, can everybody please fill in this? Sorry, we have another question.
Before you go, I need to know if any of us want to come and see you in the surgery. Is there any chance of asking anything about it?
Fine. So the brother is asking if anybody present here today or watching live wants to come to see me in my surgery, can they? So my surgery is based in Small Heath Medical Practice in Birmingham. So we do have a catchment area of patients that we can see. So I'm more than happy for brother. I pray here quite regularly anyway. And if anybody wants to contact Brother Adil, then again. Exactly. And I've really enjoyed speaking today. You've been a very attentive audience, and I'll be more than happy to. Inshallah ta'ala, return here again to talk about different things as well.
How about all the time? We have to make GP aware of family history.
So the brother's asking, do people need to make the GP aware of the family history? Yes. Very important, because we know that things like bowel cancer, breast cancer, for example, there's lots of different cancers that are linked with family history. And for example, especially in first-degree relatives, so relatives that like mother, sister, first degree, but also even in second degree, for example, nephew or niece, for example. Can everybody please fill in the feedback forms? Yeah. Can everybody please fill in the feedback form? This is really important, and the reason why is because we're going to be doing a study, a kind of looking at this, and I just want to see if this has been beneficial or not. Please provide honest feedback because I need to know how I can improve in the future as well. And thank you very much. And jazakumullahu khairan. May Allah Ta'ala reward you all. Ameen.